Today, we will talk about disc herniation, about the cause of disc herniation. In general, what is this? A hernia of the spinal disc. A normal intervertebral disc has two parts. This is a fibrous ring and a pulpy nucleus. The fibrous ring is the outer, denser part. And the inner part of the disc is the pulpy nucleus. This is the part that has a spongy, more of a soft part of the disc, and the fibrous ring is a denser part of the disc, which holds this inner pulpy nucleus, gives it a certain shape. But it is precisely the amortization that is carried out due to this inner part of the pulpy nucleus. That is, the disc is needed for there to be amortization between the vertebrae so that the vertical load that comes on the vertebra, it is distributed evenly across the entire vertebra with the help of these intervertebral discs. The first stage of hernia formation is protrusion. Protrusion is a change in the position of the pulpy nucleus itself without violating the integrity of the fibrous ring. That is, the fibrous ring, this outer shell, it is still whole when a protrusion occurs. Here is this protrusion. That is, it's just the bulging of the pulpy nucleus to the side, for example, the nerve root. That is, it protrudes. It protrudes. What can it protrude by? It can only protrude by the neighboring vertebrae, the upper and lower vertebra. Why does this happen? Because the pressure, which should be evenly distributed across the disc, for some reason it is unevenly distributed across it. Of course, we are always making some movements. That is, we tilt our head to one side, to the other side, we tilt ourselves, we turn around. And there are always moments when the disc experiences uneven stress. When tilting to one side, to the other side, that is, the load on the disc is unevenly distributed at some moments, but it has a certain strength reserve and is capable of withstanding this load. But if this happens under additional load, for example, some weight in the hands or a barbell on the shoulders, or, let's say, a sharp movement, a person falls with some kind of twist. There is also some kind of muscle spasm at this time, a twist of the spine itself, a subluxation. In this case, even the outer shell can be injured. That is, the point is that either with a sharp change in pressure on the intervertebral disc, or with prolonged incorrect pressure on the intervertebral disc, which occur with the smoothness of the lumbar lordosis, with the incorrect position of the pelvis, when the load shifts from all lumbar vertebrae to the lower one. The same thing in the neck. With a smoothed cervical lordosis, the load goes more on the lower discs in the cervical spine, which also start to gradually break down from this. The formation of a protrusion or hernia can be gradual or instantaneous due to trauma. But the first stage is protrusion, when the pulpous nucleus bulges out to one side or another, either towards the shell or towards the spinal cord. This can be, and the second stage, well, and actually the real bite is when the fibrous ring, which also has its own durability reserve, tears. That is, its fibers tear or there is a delamination of the fibrous ring. Here is where a defect in the fibrous ring occurs, and this pulposus nucleus, it just starts under pressure, which, I don't know, of course, some figures, but quite strong. Because of this pressure, this pulposus nucleus, it comes out. In this case, the pressure on the nerve root is greatly increased by the pressure on the rootlet. And if in the first case, the further displacement of the pulposus nucleus was limited by the entire fibrous ring, then this does not happen here. Here, as much of this pulposus nucleus is extruded, that much comes out. And in this case, neurological symptoms arise because there is a compression of the nerve root. What is a nerve root at all? The nerve root is inside the vertebral column. In the spinal canal, there is the spinal cord, and from the spinal cord between each vertebra, a pair of spinal roots go out, which then each branch out into their specific nerves. Each root has its own zones, its own levels of innervation. These roots come out in the intervertebral openings. That is, this is a direct continuation of the spinal cord, which then forms certain nerves. For example, often gnawing the fourth, fifth discs. Fourth, fifth, for example, the root. It forms the sciatic nerve. It participates in the innervation of the gluteal muscle, pear-shaped muscle, hamstring, posterior thigh muscle. These are the muscles that are often weak. But what saves here? The body itself begins in some way. How can it save in this case? That is, this pulpal core. It should always be isolated. It should be inside the fibrous ring. And when it ruptures, when it comes out, there is an immediate inflammation of this part of the pulpal core. That is, in this place, an inflammatory process occurs immediately. The inflammatory process there occurs to destroy this part of the pulpal core. That is, it is perceived as an antigen, as some kind of foreign agent, which the body strives to destroy. And therefore, right here, around this part of the pulpal core that has come out, an inflammatory process immediately occurs. It is necessary to remove this part of the pulpal core. This is what happens. That is, due to the inflammatory process, a certain part is destroyed as if this. That is, the inflammatory process removes this pulpal core. But what's the downside? The downside is that inflammation occurs simultaneously, and it can happen in this nerve root. Inflammation can spread there. And then there will be radiculitis. That is, this inflammatory phenomenon of the nerve root itself, in this case, will intensify. And then after the inflammatory process, a sleeping process is formed here. But thanks to this inflammation, the destruction of the pulpus nucleus occurs. That is, it can be completely destroyed. But the reason why this hernia formed, it doesn't go anywhere. And so it happens that, for example, in a month, a millimeter, 2, 3, let's say, is destroyed. But in the same month, the same amount, maybe even more, is extruded. Because the reason why this portion, this part of the pulpus nucleus came out, it doesn't go away without treatment. That is, again and again, one part of the disc came out, another part was destroyed, one came out, another was destroyed. That's how a person lives. Sometimes it's easier for him, sometimes it's worse. It happens. What are the further options without treatment, for example? What happens with the sequestration of the hernia? This is a tear of this part. First, separation. That is, some piece of hernia loses connection with the rest of the pulposus nucleus. This usually happens with sufficiently large hernias, when it even happens that this hernia is suspended and hangs over the lower vertebra, over the body of the vertebra. In this case, it happens that the connection between the pulposus nucleus and some part of the upper hernia is lost. And then it can tear off and start darting around, giving various symptoms. It is already applied in this case. Surgical treatment when it has already torn off. Because it, as a rule, having torn off somewhere, begins to squeeze the root with much greater force. If there is still some kind of reserve here, there is still some kind of reserve. Then there is this root. He still has room for him to exist here in some way. Then, during the rupture, as a rule, it is completely squeezed and ischemic nerve root syndrome occurs when the vessels of the root are compressed and it gradually dies. How can this happen? How does it happen at all? Is the treatment of hernia surgical? Surgical, one of the methods of operation. Well, the most common one now, which is used in Russia, they completely remove this entire pulposus nucleus. They completely scrape it out. They tried to perform different types of operations. They tried to remove part of this pulposus nucleus. But then again, there is a rupture of the fibrous ring, and the same hernia comes out again. They tried to remove the fibrous ring, put something there, some kind of implant. It also doesn't hold. It also comes out in the end. And in the end, the simplest method but the most effective method turned out to be surgical treatment. Perhaps there is some more modern method now, but in any case, this is still the most widespread one that is used in Russia. It's just to scrape out all the pulpous core and everything. The height of the intervertebral disc decreases. The movement in the intervertebral joint between the vertebrae is limited because the height of the disc decreases, but nothing else will protrude outside. The downside is that after a few years, the same hernias appear in the adjacent discs due to the limitation of mobility of this vertebral motor segment. The load on the other discs increases many times. They begin to break down. What is the principle of treating a disc herniation non-surgically? We're not talking about some kind of asymptomatic treatment that can be carried out. It goes without saying. That is, what does it do? What does a person usually do who has a herniated disc? First, they treat him with anti-inflammatory drugs. The main treatment is aimed at reducing this swelling, this inflammation. And this happens with varying success. If this doesn't help, over the course of several months, he is sent for surgery, and the neurosurgeon makes the decision together with the patient to perform the surgery, not to perform the surgery. What is the principle of treating hernia without surgery, not symptomatically, but when it is actually necessary? Is it possible to remove it? The point is that you can't do anything with this part of the hernia that has come out. Just like that, in an instant, quickly, it's impossible to do anything with it because it has already come out. You can't push it back in. And what can we do? We can make it so that this inner part of the pulpous core no longer protrudes outward. This is the only thing that can be done. How to do this? It's about evenly distributing the load to the adjacent disc. That is, to remove the excessive load from this intervertebral disc, from which the hernia has already protruded. This is achieved by stabilizing the sacrum and lumbar spine, particularly if the hernia is in the lumbar region. This involves strengthening all the muscles that stabilize the lumbar spine. And here, it's not just about training them all in a row, it's about finding the non-working weak muscle and restoring its function. Each muscle has a specific reason for not functioning properly. For the gluteal muscle, it could be disturbed innervation, a short piriformis muscle, or a loose sacroiliac joint. Every muscle has its own unique reason for dysfunction. And only after that start training it. So, what do we do in general? We stabilize. Lumbar, or the Shane section of the spine with muscles. The most important thing is muscles. Here the spine holds the muscles. And most importantly, they all worked symmetrically, evenly, balancing each other out. There was no significant disparity in strength between the muscles, with none being excessively short or weak. In order to relieve the increased load from this intervertebral disc. And as a result of this, the exit of this pulposus nucleus outside stops. Finally, after some time, well, somewhere, if, for example, half a centimeter bites 5 millimeters, it decreases completely from half a year. Well, half a year is needed for this fibrous ring to scar over. That is, If a new portion of the pulposus nucleus does not protrude, it turns out that what has already come out is destroyed, and this part of the disc, it scars again. A scar forms here, that is, the hernia. It again turns into a protrusion. A reverse process occurs. That is, a protrusion is formed again right here. Just the ejection of the fibrous ring together with the pulposus nucleus at the beginning. And a scar has already formed here. Such a process was seen in dynamics in the pictures. After they removed the instability, the asymmetry of the muscles and, most importantly, restored the optimal motor stereotype. Because this maximum load, it happens not only when you sit, it happens when you lie down. The maximum load occurs during walking, during a step. The previous video was about the lumbar muscle. Here is a powerful lumbar muscle. If one works during a step, the other does not work. Such an asymmetric movement of the spine stood, and this is a constant trauma of the disc. Constantly the inner part of the pulposus nucleus. The inner part of the disc, the pulposus nucleus, is extruded. Therefore, rare cases. Well, many are surprised. How can you cure a hernia without surgery? You can't cure it with an injection. You can't cure it with pills. Everything is needed here. This is it. A huge complex, not huge, but quite a lot of this all to do to get rid of all this.